Did you know that a few simple Kegel exercises can help reduce prostate enlargement symptoms and improve your quality of life? It might sound too good to be true, but science is catching up with what some doctors have known for years. Strengthening your pelvic floor can lead to real improvements in prostate health. And the best part, you can do them anytime, anywhere, without anyone even noticing. I'm Dr. Isabel Lopez, a urologist specialized in prostate health. And where are you watching from? Drop it in the comments, and stick around because I have a surprise for you at the end. In this video, you'll discover the top 3 Kegel exercises every man should know to support prostate function and feel more in control of their body. No gimmicks, just practical, doctor-approved movements that make a difference. Kegel exercises are often associated with women's health, but they are just as important for men, especially as they age. These exercises focus on one crucial muscle group, the pelvic floor. Strengthening this area helps support the bladder and prostate, reducing many of the discomforts associated with an enlarged prostate. In just a few minutes, you'll learn exactly how to do each exercise safely and effectively. We'll also talk about the science behind why these movements work and how you can incorporate them into your daily routine without stress or confusion. And don't worry, no fancy equipment or gym membership needed. This video is designed to give you quick wins. As you practice each exercise, you'll start to notice subtle improvements, stronger flow, better control, and fewer trips to the bathroom. Over time, these add up to something bigger, confidence and peace of mind. So if you're ready to take control of your prostate health with natural, proven methods, you're in the right place. Let's begin with a quick overview of what prostate enlargement is and why it's so common. Follow the channel so you don't miss what's coming next. Prostate enlargement, known medically as benign prostatic hyperplasia or BPH, is one of the most common conditions affecting men over 50. It's not cancerous, but it can seriously impact daily life. As the prostate grows, it presses against the urethra, the tube that carries urine out of the body, causing all kinds of uncomfortable symptoms that most men quietly endure. You might be dealing with it without even realizing. Frequent urination, especially at night, a weak urine stream, the feeling that your bladder isn't completely empty. These are classic signs. Some men even report difficulty starting urination or the sudden, urgent need to go. It's not just frustrating, it affects sleep, focus, and confidence. So, what causes this prostate growth in the first place? Age plays a major role. As testosterone levels decline and estrogen levels shift, the cells in the prostate respond by multiplying. Over time, the gland enlarges. Lifestyle factors like poor diet, lack of exercise, and chronic stress can speed this process up. Now, here's the part many men overlook: medication isn't the only option. In fact, natural approaches like targeted exercise can complement medical treatment or even help delay the need for it. The body has a remarkable ability to self-regulate when given the right tools, and Kegel exercises are one of them. When you strengthen the pelvic floor muscles, you create more control over the bladder and reduce the pressure on the urethra. That means fewer interruptions at night, more comfort during the day, and less worry about embarrassing leaks or urgency. It's a simple shift that offers real benefits, and that's exactly what we're diving into next. You'll see why Kegel exercises have become a go-to strategy among urologists and wellness experts alike. They are not just effective, they are empowering. Kegel exercises are deliberate contractions of the pelvic floor muscles, the same ones you use to stop urination midstream. These muscles form a kind of hammock that supports your bladder, bowel, and, yes, your prostate. When they are strong, everything in your lower body works better. When they are weak, you feel it in ways you might not even realize. For men dealing with BPH, Kegels offer a targeted, natural way to regain control. Strengthening the pelvic floor helps reduce pressure on the bladder and urethra, leading to improved urine flow and fewer sudden urges. It's not about replacing medical treatment. It's about enhancing it with a tool that puts you back in charge of your body. One of the biggest advantages of Kegel exercises is their flexibility. You don't need a mat, weights, or privacy. Whether you're sitting in traffic, working at your desk, or relaxing on the couch, you can do them discreetly. That means consistency is easier, and results can come faster if you stick with the routine. Studies show that men who perform pelvic floor training regularly often report improved bladder control, fewer nighttime trips to the bathroom, and increased confidence in social situations. It's a subtle transformation that builds over time, something you feel more than you see, but that changes everything. What's more, Kegels improve blood flow to the pelvic region, which may enhance sexual function and overall vitality. That's a side benefit most men don't expect, but one that makes this practice even more worthwhile. This isn't just about avoiding discomfort, it's about optimizing your health as you age. So how do you get started? In the next segment, we'll walk you through the first of 3 powerful Kegel exercises you can begin doing today. It's simple, quick, and surprisingly effective. Let's start with the foundation, the basic pelvic floor contraction. This is where every man should begin. Think of it as the groundwork for building strength and awareness in a muscle group you've probably never paid much attention to before. The goal is simple: activate the pelvic floor and hold that tension with control and precision. Here's how you do it. Imagine you're trying to stop urination midstream or prevent passing gas. Those are the exact muscles you want to contract. Once you've located them, tighten and hold the contraction for 5 seconds. Then, slowly release and rest for another 5 seconds. Repeat this cycle 10 times in a row, ideally twice a day. If you're doing it right, you shouldn't feel movement in your thighs, buttocks, or abs. Many beginners make that mistake, so keep your focus strictly on the pelvic floor. A good way to stay mindful is to breathe deeply and relax the rest of your body while holding the contraction. This builds control as much as it builds strength. This basic move is incredibly effective. Over time, it tones the pelvic muscles that support the bladder and prostate. That translates into better urinary control and reduced pressure in the lower pelvis, 2 major benefits for men dealing with BPH. It's a small effort with a big return. And remember, consistency is key. It's better to do this exercise daily with proper form than to overdo it and strain other areas. The first few days may feel awkward, but stay with it. Within a couple of weeks, you'll begin noticing subtle but important improvements in comfort and control. Join the Members Club and leave a super like if this first exercise made sense to you, because next, we're dialing up the intensity just a bit. Get ready for the second Kegel move that builds speed and responsiveness like nothing else. Now that you've built a foundation with basic holds, it's time to train your pelvic muscles for speed and responsiveness. Quick contractions, also called Kegel pulses, target your fast-twitch muscle fibers, which are responsible for those split-second reactions when you need immediate bladder control. This exercise is short, sharp, and surprisingly powerful. To begin, sit or lie down in a comfortable position. Focus on the same pelvic floor muscles you used in the basic hold. This time, contract them quickly and release just as fast. Each contraction should take about 1 second. Aim for 10 to 15 repetitions in a row, and do up to 3 sets if your body allows it. As with all Kegels, form matters more than intensity. Keep your legs, glutes, and abs relaxed. The only area that should be working is deep inside the pelvis. If you feel tension elsewhere, reset your focus. It might help to place one hand on your stomach to ensure it's staying still during the exercise. These quick pulses help improve the responsiveness of your pelvic floor. That means when the urge to urinate hits suddenly, your body can react faster to hold things in. For men with BPH, this kind of control can be a game changer, especially in public or during long meetings when getting to a bathroom isn't an option. Over time, this exercise also helps prevent minor leaks and reduces urgency episodes. It's a simple daily habit that trains your nervous system to respond more efficiently, adding a new layer of support to your urinary function. And again, no one has to know you're doing them. That's the beauty of Kegels. Stick around, because next you'll learn how to build true pelvic endurance, the kind of strength that holds up over time. If you're ready to take it to the next level, the third Kegel technique is exactly what you need. If quick contractions train speed, endurance holds build stability. This third Kegel technique is designed to strengthen the pelvic floor's capacity to stay engaged over longer periods, something that's crucial for men dealing with frequent urgency or incomplete bladder emptying. It's a powerful upgrade from the basic hold. To perform the endurance hold, engage your pelvic floor muscles just like before, tighten as if you're stopping urination midstream. But this time, hold the contraction for 10 to 15 seconds. Keep your breathing steady and the rest of your body relaxed. Once the hold is complete, rest for at least 10 seconds, then repeat. Aim for 5 full repetitions. It might feel challenging at first, especially if your muscles aren't used to this kind of sustained effort. That's completely normal. Like any muscle group, endurance builds with practice. Don't push to the point of discomfort. Instead, focus on gradual progress, adding a second or two each week as you build strength. This exercise enhances your pelvic floor's ability to support the bladder and prostate under pressure, such as during long walks, standing for extended periods, or overnight while you sleep. That added resilience can significantly reduce the number of nighttime trips to the bathroom and improve the quality of your rest. Another key benefit is improved circulation. Longer contractions increase blood flow to the region, promoting tissue health and supporting the prostate gland's function over time. It's not just about muscle, it's about restoring balance to an area that often gets overlooked until problems arise. Join the Members Club. Drop a super like, follow the channel, and leave a comment if this is the kind of natural health advice you've been looking for. And now that you've mastered all 3 exercises, let's go over some expert tips to avoid common mistakes and get the most out of your Kegel routine. Now that you know the exercises, let's make sure you're doing them right. One of the most common mistakes men make with Kegels is recruiting the wrong muscles. If you're tensing your abs, thighs, or buttocks, you're not targeting the pelvic floor. That can lead to strain without results. Always focus inward, on the deep muscles you engage when stopping a stream of urine. Another frequent issue is holding your breath. It might feel natural to brace your core and lock your breathing during the hold, but that's counterproductive. Instead, breathe slowly and naturally as you contract the pelvic floor. Oxygen flow helps the muscles stay relaxed and functional while strengthening, which leads to better results over time. Consistency is what separates success from frustration. These exercises don't work overnight, but they do work. Make them a daily habit, just like brushing your teeth. Morning and evening are ideal times, but even one focused session per day can create meaningful change. Set reminders on your phone or attach the habit to an existing routine. Posture also plays a role. Kegels can be done sitting, standing, or lying down, but start with the position that gives you the most control. Most men find it easiest to begin lying down, then progress to sitting, and finally to standing. This gradual progression mirrors the way your muscles adapt and build functional strength. Track your progress. Notice how many times you're waking up at night, how urgently you need to urinate, or how confident you feel in social situations. These small wins are proof that the exercises are working. Keep a journal or use a simple note app to stay motivated as the improvements stack up. Up next is a quick recap of the 3 exercises and the long-term benefits they bring. You've already done the hard part, learning and practicing. Now let's look at how they all come together to improve your prostate health and quality of life. You've now learned the top 3 Kegel exercises every man should know: the basic pelvic floor contraction, the quick pulses, and the endurance hold. Each one plays a specific role in helping your body regain control, reduce pressure, and support prostate health naturally. These aren't just exercises, they are tools for long-term well-being. Let's quickly recap. The basic hold builds awareness and foundational strength. The quick contractions train your pelvic floor to respond rapidly when urgency strikes. And the endurance hold creates lasting support for daily activities and better rest at night. Together, they form a complete system to protect and strengthen your prostate. The benefits go beyond comfort. With regular practice, many men report fewer nighttime trips to the bathroom, stronger urine flow, and greater confidence in public or during travel. These improvements build slowly but steadily, and they are yours to keep when you stay consistent. It's your body responding to focused effort. More than that, Kegels offer a way to be proactive. Instead of waiting for symptoms to worsen, you now have a natural method to support your urinary health and reduce discomfort linked to BPH. Think of it as preventative care, without side effects, without cost, and entirely within your control. If you found this helpful, subscribe, like, and share this video with other men who may need it. Whether they are already managing prostate issues or just starting to think about prevention, this information can make a difference. And don't forget to check out our other videos for more natural tips to stay healthy, strong, and confident. This is Dr. Isabel Lopez, and I hope today's guidance empowers you to take charge of your prostate health. Keep practicing, stay consistent, and always listen to your body. It's the best investment you can make in yourself.